This video is on the muscular system. And throughout this video, we're going to cover a couple of different areas. We're going to cover the face, eye, neck, and trunk muscles. So let's start out with the facial muscles. So here we're going to be looking at an anterior view. And let's just draw out someone's head right here. And we'll give them some ears. Alrighty. So let's also give them some eyes and a nose, so we have kind of a reference for how things are gonna be oriented, as well as a mouth. So our first muscle is going to be called frontalis. And basically for all of these muscles in the muscular system, I'm going to need you to know the name of the muscle and the action of the muscle, meaning like what it does. And for some of them, I'm also going to ask you to know the nerve. Now, for all of the muscles on the course webpage, there is a PDF of the different muscle names, their location, their action, and their nerve. And I just want you to know only the things that are written on in those charts. So if there's something that's blank, for example, for a lot of the muscles where the nerve is that's blank, I want you to, you don't have to learn that nerve, for example, okay? So the other thing is, for a lot of these muscles, there are things called an origin and an insertion. That means the first place that a muscle attaches and the second place that the muscle attaches. Now, when a muscle moves or contracts, the origin and insertion locations are pulled closer together, making the muscle move. For example, your pec is attached to your chest at like your, let's just talk about like we reviewed our sternum. So there's one part of the pec that attaches at your sternum, and then the other part of the pec that attaches at your humerus. And when that muscle contracts, it pulls those two areas closer together and kind of creates the action that muscle completes. Now, there are multiple different actions for multiple different muscles, but I only want you to know the main action, which is the ones that are written in your charts. So just a heads up for what those charts look like. All right, now let's jump back in here. The first muscle I mentioned was frontalis, and that muscle is right here on the forehead. And always, I'm not going to write all of the actions out, so you'll just be responsible for looking at them on the charts that I gave you. But frontalis, it's on the forehead right here, and it like scrunches up your face, the skin over your forehead, and it helps to elevate your eyebrows. And that makes sense based on location, right? So if we think about these muscle fibers contracting together, it's going to pull up on the eyebrows, which are right there. Our second muscle is called orbicularis oculi. And that muscle is going to be essentially a circular muscle that's right around the eyes and looks just like this. whenever there's a word orbicularis, it always means like orbit or circular. So again, orbicularis oculi. And the action of that muscle, as you can see, is it's all around the eye. So when it contracts and shortens, it's going to close the eye to help you basically blink. Our next muscle is called corrugator supercilii, and it's oriented almost to look like someone has like angry eyes right there. And what this muscle does is it wrinkles, creates those wrinkles between your eyebrows by kind of scrunching things up. Now remember we talked about orbicularis oculi around the eyes. We actually have another orbicularis, and that's our orbicularis oris, that is around the mouth. And it allows people to do like a blowing or kissing motion. So it's going to be all around the mouth in this nice like orbital or circular structure. And this is called orbicularis oris. Make sure you don't get that confused with orbicularis oculi. Now, another side note is there are a lot of face muscles that we're not reviewing. We're just reviewing kind of some of the main ones. All right, and remember orbicularis oris, that helps with like blowing or kissing motion. Now you have one other muscle that helps with blowing, like if you're gonna blow birthday candles out, etc. And that is a small muscle to the side of the mouth on both sides, and that's called buccinator. Our next muscle is called, well, it's actually two different muscles, but we're grouping them together. It's called zygomaticus major and minor. And what those muscles do is they help elevate the upper lip. So they're going to be right about here. We have a major, which whenever we have a major of something, it's always going to be bigger. And then we'll have a minor here as well. Major and minor. So I really just want you to know them as a group though. As a group, they're called zygomaticus major and minor. Now the last muscle that I want you to know here is actually one that attaches both to the mandible and to the neck. So I'm going to draw it on the neck here. And that is our muscle called platysma. And it's all along the neck here. Oops, I didn't mean to make this guy's chin asymmetrical. That was an accident. So that is our platysma. And that helps assist with depressing or like lowering the mandible because it's attached to both the neck and the mandible. So those are the face muscles that I want you to learn. Now, the next muscles may seem like face muscles, but they're actually muscles that we call muscles of mastication. Mastication means chewing. So they help us chew food. Now for these muscles, for both of them, we're actually going to do a lateral view just to make it a little bit easier for us, but we can see them anteriorly as well. Now for both of these lateral views that we're going to do, the first one is going to be more superficial, meaning more towards the surface, if you don't remember what that term means. And then the second one is going to be more deeper, so deeper in towards the center of the skull. So let's draw this first one. This is going to be superficial. And we'll draw a lateral view. There we go. There's someone's head. And what I'm going to do is kind of draw the mandible in right here. So this chunk is just going to be our mandible. And you have two different muscles that I really want you to pay attention to for the more superficial ones. And those two muscles are, the first one is called temporalis. So that's like right around where your temple is. So it's going to be pretty wide here around that. Remember, we've talked about the temporal part of the skull as well. So these are all going to be our chewing muscles. And just to make sure we don't mix things up, because I'm using some of the same colors, I'm just going to draw a line right here to separate our face from our muscles of mastication. And then in addition to temporalis, we're also going to have a muscle called masseter. And that's, of course, you know, we're doing muscles of mastication, so that's going to help with chewing as well. And I forgot to write the name temporalis. There we go. And now for masseter. There we go. So we have our masseter muscle as well. Now remember, these are superficial muscles. Now we're going to draw the same view but deep muscles. So we're going to draw a lateral view again. Alrighty, so for these deep muscles, the two ones that I want you to know are called lateral and medial pterygoid. Now, do you remember that term from when we learned about the sphenoid bone and the skeletal system? Well, it's the exact same terms that we're using, and actually the lateral pterygoid muscle attaches to that lateral part on the sphenoid bone, and same with the medial pterygoid. So that's how we can kind of associate those two terms together. But let's draw those two out. So we'll do our medial pterygoid first. And let me draw a part of the mandible in here, just like on the other figure. So we have our medial pterygoid like this. And remember, this looks pretty similar to the masseter, but this is deeper inside. And you can remember it because lateral and medial pterygoid are terms that we use with the sphenoid bone. And the sphenoid bone is deeper in the skull, so these muscles have to be deeper because they attach to that deep bone within the skull. Or the deep component of that bone within the skull. So we have our medial pterygoid, and then we also have our lateral pterygoid. And I'm actually going to add one more different picture in of those two muscles. So you know how these are both lateral views, right? We have superficial and deep. And what I'm going to do, just to kind of make it a little bit clearer, is I'm also going to draw a small anterior view down here. And here is our sphenoid bone. Remember, it's kind of oddly shaped. And then I'm going to draw our mandible in. So that's going to be this piece down there. So remember, this is an anterior, just like condensed view of things. And in case you just want a different view of the medial and lateral pterygoids, the medial one is of course going to be more medial when we're viewing it anteriorly. So it's going to attach from the sphenoid bone right here to the mandible on both sides. And then the lateral pterygoid, of course, is going to be more lateral, and that'll attach from this lateral aspect of the sphenoid to the mandible as well. So those are what I want you to know for the facial muscles as well as the muscles of mastication. Now let's move on to muscles of the eye. Now for muscles of the eye, I'm going to draw an anterior view. And it's going to be the right eye. Now, as usual, we're going to start by drawing an eye out. So here is our eyeball. And there's our pupil. I know it looks a little bit creepy. But just to make sure we're kind of getting a good visualization of this, what this right eye looks like, I'm also going to just draw a nose right here. All right, so let's start reviewing these major eye muscles. The first muscle we will discuss is called medial rectus. This is our medial rectus muscle, and it attaches on the eye medially, and it extends deeper into the head. So if you think about this muscle pulling the eye from the medial aspect, what it's going to do to this eyeball right here is it's going to adduct the eye, or basically make the eye move medially so you can look at the medial portion of your face, for example. So it's going to adduct the eye or turn it to face medially. So that is our medial rectus. Medial rectus. And now on the face and muscles of mastication, I didn't need you to know the innervation, or the nerve is another way of saying that for each muscle. But for these eye muscles, I do want you to know the innervation, or the nerve that innervates each muscle. And what I mean by that is there's a specific nerve going to every muscle, and we'll review this more when we talk about our nervous system. But each nerve goes from our brain, and it sends fibers down to each muscle and gets the muscle to activate when we want it to. So if you want to bring your eyeball and look in like medially, almost from your right side to your left side, that's the medial rectus muscle is going to be activated to do that. And for most of these eye muscles, they're going to be innervated by oculomotor, or cranial nerve number 3. Now in the nervous system, we're also going to go over more details about those cranial nerves. Remember, we talked about those when we talked about the skull foramen. But for now, I'm just going to list them in terms of nerves that they're innervated by. And the best resource for looking at those nerves and actions, again, is those tables or charts that I've posted on our course webpage. So reference that. So just so you know, most of these will be innervated by cranial nerve 3. All right, so that's our medial rectus. Then we have a superior rectus, which is just like it sounds. It's superior. And rectus means straight up and down. So these muscles that have the word rectus in it are all going essentially straight in a line deeper into this page, into the skull. So superior rectus, and that superior rectus is also innervated by cranial nerve number 3. Then we have, and what that does is it brings the eye superiorly. So these names are actually really self-explanatory for a lot of them. And I really recommend looking at like YouTube videos of the actions of these muscles, because it can be confusing as well, just to kind of understand things, especially once we move beyond the rectus muscles. Now, again, the superior rectus moves the eyeball so it's turning upward, as if you're going to look up at your forehead. Now we have our inferior rectus muscle, and that will bring the eye down, as if you're going to look down at your toes. Oops, R-E-C. I missed a C there, rectus. Now you also have a lateral rectus muscle, and that lateral rectus muscle is the only one of these three that's not innervated by cranial nerve number 3. Your lateral rectus is laterally, and then it brings your eye looking laterally if you want to look to the side of your body. And what this does is it abducts your eye. So it brings your eye laterally, and that's the way that you can remember it, because remember, all three of these are cranial nerve number 3, but this lateral rectus is actually cranial nerve number 6, which is also known as abducens nerve. And you can remember that because your lateral rectus abducts your eye, so it brings it away from midline. If this is our midline, it brings it away from it. And that's what abduction means. So we know that our abducens nerve is going to innervate that muscle. Now we have one muscle up above, and that is called our levator palpebrae superioris. And that's further up here. And that is yet another muscle innervated by oculomotor or cranial nerve number 3. And what that does is it raises the eyelid. So if you picture your eyelid right here, it's going to raise it up so you can open your eye. Remember, that's kind of the opposite of what our other face muscle did, or orbicularis oculi, that helped close your eyes. Now this helps open up your eyes. So in addition to all of our 4 rectus muscles and this muscle for eyelid, we have 2 other muscles that are called oblique muscles. That first one is called our inferior oblique. And what that muscle does, here, I'll actually draw it out first. It comes around kind of like that. That's our inferior oblique. Now for that muscle, what it does, it's a little more complicated than the rectus muscles that are just like in a straight line. As you can see, it's kind of curved and going off towards the side. And what it does is the inferior oblique brings the eye up and in. And it's also innervated by the oculomotor cranial nerve, which is cranial nerve number 3. So it's kind of confusing. It's easier if you look at a model and also look at videos in terms of eye motion. But our inferior oblique, again, it brings our eye up and in. Now we're also going to have a superior oblique muscle, which will do the opposite of what the inferior oblique muscle does. And the superior oblique muscle is going to be one of those exceptions where it's not innervated by oculomotor or cranial nerve number 3. So it's actually going to start kind of down here, and it's going to move underneath superior rectus, and it's going to come out to the side, just like that. So that's our superior oblique. And the superior oblique is going to bring your eye down and out, which remember is the opposite of what the inferior oblique does. Now, I'm just going to put a little star there because this is one of those few muscles that is not innervated by oculomotor. The lateral rectus is the other one that's not innervated by oculomotor. Remember, we talked about the lateral rectus as being innervated by abducens, and this superior oblique is actually innervated by the trochlear nerve. Now, you can remember that the superior oblique is innervated by the trochlear nerve, which is cranial nerve 4, because you see how there's this weird curve here on the superior oblique? Well, there's actually something specific that holds it up like that. So I'm going to draw that in. It's this little structure that I'm drawing in green, and that is called the trochlea. And that's what holds the superior oblique up. So that's how you can remember that the superior oblique is innervated by the trochlear nerve, which is cranial nerve 4. Alrighty, so that covers all of our eye muscles. Remember, we have our 4 rectus muscles. We have our muscle for elevating our eyelid, and then we also have our 2 oblique muscles right here. The only ones that are innervated by oculomotor, which is cranial nerve number 3, are the ones with the stars here. Lateral rectus is innervated by abducens because it abducts the eye, and superior oblique is innervated by the trochlear nerve because it's held up by this little thing called the trochlea. So remember, all of these rectus muscles, you can't see the full extent of the muscle, but they go like into the paper, deeper into the skull, kind of in a straight line. So look out for that on the muscles or any videos that you watch in terms of eye motion. Now, this covers our eye muscles, and the next thing we're going to cover is our neck muscles. So let's actually do that on the same page here, since we have plenty of room. Now, again, as is the case for most of these muscles, we won't cover every single muscle in the body in this course. So just make note of that. We're only going to cover what I view as more relevant to clinicians, since most of the people taking this course will end up doing clinical work. All right, muscles of the neck. Now, we're only going to cover, let's see, 1, 2, 3 muscles here that I view as the most important ones. Now, let's start with a small posterior view. We need the posterior view just to look at one of those muscles. And they're really important muscles because they can lead to a lot of symptoms in people. So let's draw them out and then we'll talk about them a little bit more. So here's our posterior view. We're gonna have a head with some ears and then a neck. So your muscles that we're talking about are your suboccipitals. If you remember, we have the occipital part of the skull, or in that occipital bone, and these are actually underneath that occipital bone, so that's why they're called suboccipitals. So let's draw them in. They go from the skull to the neck, and there's actually a bunch of different detailed, like 6 different, actually I think there's 8 different suboccipital muscles, but we're just going to learn it as one big group of muscles that goes from the back of the skull here to the neck. What's really important about these muscles is they can actually, have you ever felt a headache that almost feels like it's behind your eyeballs? Well, these muscles, the suboccipitals, can create referred pain, basically meaning that the source of the pain is from these muscles, but you feel the pain somewhere else. So these muscles can make you feel pain because of how like the nerves are distributed and everything like that. They can make you feel pain on your forehead or almost like as if it's coming from behind your eyes. Now, oftentimes in a clinic, from a physical therapy perspective, I've had lots and lots of patients who come to me and they've had like MRIs, CT scans, a bunch of different things on their brain, because oftentimes when people have headaches, there are neurological conditions going on. But when people describe a headache as coming from like behind their eyeballs or on their forehead, something that I'll make sure to check out is their suboccipital muscles. And they're usually very overused and tight because they get shortened with poor posture. And when I give those muscles their proper like length and mobility by working through any tension in their muscles, it can relieve those headaches. So that's why I really want you to know what these muscles are. Okay. Now we have two other muscles that I want to discuss, and let me actually draw that in a lateral view. So I'm going to draw a person here. Alrighty. So I'll explain what these little things are in a moment, but I'm going to give him an ear, and that is actually going to be our mastoid process right below the ear. Hopefully you remember that from our skeletal system lecture on the skull. Now the reason I drew that and the reason why I drew the clavicle and the sternum here is because we have a muscle called sternocleidomastoid. Let me write that out for us because it's a little bit tricky. Sternocleidomastoid, often abbreviated as SCM. And it gets its name because sterno refers to sternum, cleido refers to clavicle, and mastoid refers to mastoid process. So you have aspects that attach from the sternum up to the mastoid process and from the clavicle up to the mastoid process. So it's like a two-part muscle with two different heads. One comes from the sternum up to the mastoid process, one comes from the clavicle up to the mastoid process. Now, again, remember when we're talking about actions for all of these muscles, they're really simplified. So oftentimes there are lots of actions for different muscles, but I just want you to know the main action. And the main action I'm asking you to learn for the sternocleidomastoid muscle is it flexes the cervical spine, meaning that it helps you bring your chin towards your chest. There are a lot of different functions when it's used, when just like one side of your sternocleidomastoid is used, because remember, our muscles are always bilateral. So right here, we're just viewing like the left side of someone. This person has the same muscles on the opposite side. Alrighty, what's special about this muscle is that it's actually innervated by another one of our cranial nerves that we learned when we were talking about the skull foramen. It's innervated by spinal accessory nerve, which is cranial nerve number 11. And again, we'll learn more of that when we get to the nervous system. So just pay attention to it when you're looking at your charts and your tables on all of the muscles. Now, the other thing that I wanted us to learn here is our scalene muscles. And I'll write those out for us. Scalenes. For these scalenes, we have an anterior, middle, and posterior scalene. So I'm going to draw our anterior, middle, and posterior scalene. Okay, so these scalene muscles are deep to the sternocleidomastoid, meaning like they sit deeper into the body. Just in case like you're curious about the separate or the overlap that you see right there. Now, these scalene muscles, technically their action is to elevate the first and second rib. And however, the reason why they're more clinically important is because there's a really important aspect that can lead to symptoms in the upper extremity. And I'm going to draw something yellow in between the anterior and middle scalenes. That is called your brachial plexus. Now, you don't need to know the details of what this brachial plexus is, but what the brachial plexus is in general is it's a plexus of nerves, and those nerves kind of travel out from your neck, and then they make their way down to both of your arms. Muscles that they have to travel in between when they make their way down to the arms is, one of them is in between the anterior and middle scalenes. Now that's important because if you have excessive tension or like shortened muscles, scalene muscles here, it can lead to compression on the brachial plexus, and essentially nerves don't like when they're not getting good blood supply and when they can't move freely. So when they're being when there's like a mechanical interface, which are these muscles, that's harming the brachial plexus or kind of squishing it, it can lead to neural symptoms in the arms, and that could be anything from like numbness, tingling, and burning, or pain. So that's why this is clinically relevant. And so we talked about the suboccipitals, which are important because, it can refer pain to the front of the head or behind the eyes, but the action of them is to extend the head. And since we tend to extend our head a lot with poor posture, they can be overused. So those are our suboccipital muscles. Then we have our anterior, middle, and posterior scalenes. And then we also have our sternocleidomastoid, which is innervated by that spinal accessory nerve, cranial nerve 11, and serves to flex our neck. So that does it for our neck muscles. Next, we're going to move on to our abdominal muscles. Alrighty, for abdominal muscles, as usual, we're going to start by drawing something out. So I'm going to draw someone's abdomen. So that's someone's belly right here. This is an anterior view. So this would be their right and their left. Sometimes I forget to write those in. So this is someone's belly. I'm going to give them a little belly button or umbilicus right there. And we're looking at the front of it. Now I'm going to start off with something that's not technically an abdominal muscle, but it is kind of helps form part of your core muscles in your abdomen. And that is called your diaphragm. So let's color that in. That's going to be a muscle that's kind of forms the roof of your abdomen, and the diaphragm is our big breathing muscle, so it helps us take a nice deep breath in. Now our diaphragm is important because it helps us breathe, so it's really necessary for us to have the ability to use that muscle for us to stay alive. And what innervates that muscle or kind of powers that muscle is our phrenic nerve. And what happens for nerves is they come from different places all around their spine. That's where all of our nerves originate. And when we're talking about the places in the spine that the nerves originate from, we can take any one of the nerves that we talk about for any of the muscles in the body, and we could determine where they come from the spine, or if they're cranial nerves, where they come from the head. Now, the reason I'm explaining this is because our phrenic nerve, which innervates the diaphragm, comes from a very specific place in the neck, It comes from our C3, 4, 5 nerve roots. Now remember, when we were talking about spine bones, those vertebrae, there we would refer to the third one in the cervical spine as C3, etc. And so each of those vertebrae are associated with different nerves. Now, when we're talking about this phrenic nerve, I'm just going to write it in so you can see. Phrenic, and then I'm going to abbreviate nerve with NN. That phrenic nerve is so important because it helps us breathe, and it comes from the nerve roots that are labeled C3, 4, 5. Now again, we're going to go over those nerves and all of this nervous system stuff in more detail when we go over the nervous system, but just for now, remember that the phrenic nerve helps the diaphragm activate, and it's innervated by C3, 4, 5, those specific nerve roots, okay? Now we kind of have the roof of the abdomen, but let's label a couple different structures. The first one, well, I already told you, is your belly or your umbilicus, but I also just want to draw a line down the center here because there's a white line that goes down the center of the belly, and that is called the linea alba. The linea alba is not a muscle, but I just want you to be able to recognize it when you see it on a model or on like a cadaver or anything like that, because it's a point of attachment and where some of your abdominal muscles will come together. All right, let's start with the first muscle that's actually truly considered an abdominal muscle, and that first one is called our rectus abdominis. So that's commonly where people will get like a 6-pack or an 8-pack or whatever people are getting these days. So we're going to draw in our rectus abdominis. There's kind of going to be 4 different pieces on either side, and that's where people can kind of get their so-called 6-pack or whatever. So this is our rectus abdominis. What's interesting about the rectus abdominis is everyone's always concerned about getting abs and looking good, but the funny thing about it is that your rectus abdominis helps to flex your trunk, almost like do like a forward bend. But it's really not very functional for actual stabilization of your core and of your abdominal area and of your thoracic area. So there isn't a whole lot it can do in terms of you functionally being very, very strong, but it can look good. So that's the crazy thing, is a lot of times people are spending so much time on these specific muscles that don't make you stronger, but they just make you look good. So anyway, that's our rectus abdominis that helps us flex our trunk. Now we have our next muscle is our transversus abdominis, and actually for these next 3 muscles, they are all like overlapping one on top of the other. So I'm going to start with the deepest muscle and work our way out. So the deepest muscle, I'm just going to use it representing lines here. It's called our transversus abdominis, and it covers basically like all of our belly here, but I'm just drawing lines to let you see where this muscle lies. And this is our deepest one. I'll draw a superior view in a moment, so we'll be able to get a better idea of how these are overlapped on top of each other. But that's transversus abdominis. Now the next most superficial layer is the internal obliques. So I'm going to draw that represented by this diagonal line, just because I want us to see that they're all in the same area, but they are overlapping each other. Now, the other reason why I'm drawing the lines in this way is because that's how the muscle fibers are oriented. So your transversus abdominis is oriented and the fibers are oriented in this way. So when they contract, what the action is of that muscle is it really just compresses and supports your abdominal viscera, meaning your abdominal organs. Now, this one that we just drew in, which is the next most superficial layer, is our internal, I spelled that wrong. Internal. That should say internal, even though it's very messy. Internal obliques. And what the internal obliques do is they help with what we call ipsilateral trunk rotation. So they help with us rotating our body to the same side. So the right side of our right-sided internal obliques will help us turn our trunk to the right, and our left-sided internal obliques will help us turn our trunk to the left. Now, the next most superficial layer is our external obliques. And those are, the fibers are oriented the other way, like this. And what these external oblique muscles do is they do contralateral trunk rotation. So the left external obliques help us rotate our trunk to the right, and the right external obliques help us rotate our trunk to the left. Okay? So to get a little bit of a better understanding of these, let's also do a superior view. So this was our anterior view, and now we're going to do a short superior view right down here. So all we're going to be doing is we're going to be, let's just draw our trunk here. So here's a little vertebrae in the back, so we know that this is anterior and this is posterior. So we're looking a superior view, we're looking down into someone's like little belly. So I just want to do this because I want to show you that our external obliques are the most superficial layer. So that's going to be the most technically like anterior when we're looking at it from the anterior view. And then the next deepest layer is going to be our internal obliques. And then the deepest abdominal muscle overall is going to be our transversus abdominis, which again, it kind of makes sense, right? Because the action of that is to help compress the abdominal viscera or abdominal organs. Now, this of course is not really drawn to scale, so you have a bunch of organs and stuff that sit right behind the abdominal muscles, but I just wanted you to see another view of how these muscles are stacked. Now, one more note about this is what helps me remember that the external obliques are oriented in this way compared to the internal obliques is because when I think about external obliques, I kind of think about like putting my hands in my pocket. And if you pretend you're putting hands in your jacket pocket, your fingers are oriented from like superiorly laterally to inferiorly medially. So that's kind of how I remember thinking about external obliques and putting something in my pocket to remember the fiber orientation, because that's what can help us distinguish the muscles from each other. All right, so now we are going to cover back and chest muscles. Now that we're done with these, so I'm going to draw a line to separate things out here, and we're going to move on to back muscles. Now let me again draw a little figure here. We're going to draw a little guy. Here's his head and neck and shoulders. I always try to make these symmetrical, but it doesn't always work out well, as you can see. So here's a little sacrum, and here's parts of his pelvis right there. And we are looking at a posterior view because we're looking at back muscles. Now, let's go over the 4 specific back muscles I want you to learn. Again, this isn't an exhaustive list, but I want you to basically just get an idea of some major back muscles that are important functionally. Alrighty, so the first muscle I want us to learn for the back is called our trapezius. There are actually 3 different parts, but I just want you to know the main one. What it does is it helps us move our scapula, and it has several different places that it attaches. So it attaches to our skull here. It also attaches to certain parts of our spine down here, and then it also attaches to part of our scapula out to the side. So it kind of ends up looking like this trapezoid type muscle shape. If you've ever heard of like overusing your upper traps, which are up here towards like the top of your shoulders, that's one component of our trapezius muscle that we're learning about. But I just want you to know it as one big piece. Essentially, I don't need you to break it up. So I'm just going to write trapezius. And then I'm going to write a little note that there is an upper, middle, and lower. But that's all we need to know for now. There are a lot of different actions, but what I want you to know is that it moves the scapula. That's one of the main actions of this muscle as a whole. And remember, we had a muscle when we learned about our neck where it was innervated by our spinal accessory our spinal accessory nerve, which was cranial nerve number 11. That was our SCM, or sternocleidomastoid. Now, this trapezius muscle is also innervated by that same cranial nerve. So reference your charts for that. Now, our next muscle is called our latissimus dorsi. You may know it as like your lats. So that is going to come from different aspects of our spine down here, and it's going to come around and actually attach to our arms. I don't need you to know the precise attachment points, but I do need you to just know the names and the actions and sometimes the nerves of these muscles. What I'm going to do is I'm going to talk about the places where these muscles attach, because sometimes it can help us understand the action of the muscle. So our latissimus dorsi, our lats, one of the main actions of it is it helps extend our arm. Now, it comes from parts of our back and wraps around and comes onto our humerus. And when that muscle contracts or shortens, it's going to extend our arm or extend our shoulder. Alrighty, so that kind of brings me to a new point. Whenever I'm talking about the action of a muscle, I can either say that here, let me show you. I'm going to put my elbow in here. All right, so here's my elbow right here. You can kind of see my hand off to the side. If I'm flexing my elbow, I'm decreasing the angle right here in my elbow joint, okay? So this is elbow flexion. I could also say, so that's my first way of naming things, by the joint at which things are moving. My other way of naming things is talking about it in terms of the distal aspect of what's moving, meaning my forearm. So this is called I could say I'm flexing my elbow. I could also say I'm flexing my forearm. So just note that when you're looking at the different actions of the muscles, we could be referring to the joint itself that's moving or the most distal aspect. It would be incorrect for me to say I'm flexing my arm when I'm doing this, because my arm isn't really the thing that's moving. It's really my forearm. So we're always referring to the distal-most aspect, or the distal-most bone that meets at this joint. So in this case, it's our forearm, and then rather than our arm up here. Okay, so when we're talking about the latissimus dorsi, which let me write in. When we're talking about the latissimus dorsi, it extends our arm, but we could also say that that's the same thing as extending our shoulder. Okay? Alrighty, so our next muscle that we're going to learn is called erector spinae. It goes all the way from parts of our neck down through the rest of our spine. There are a lot of different components of erector spinae, but I'm just going to show you just one general muscle. Oops, I spelled that wrong. There should be just one. It's R-E-C-T-O-R, erector spinae. And what this muscle does is it basically stretches from our cervical spine all the way down through our lumbar spine. And what it does is it extends our spine. Extension kind of sounds like erector, so that's how you can remember it, that erector spinae extends our spine. Now, the last muscle that I want you to learn is our quadratus lumborum muscle, and that goes from some of our spine and our lowest rib, which is what this little black line is on either side, and it goes and it attaches onto our pelvis at our iliac crest. And again, this is another one of those muscles, like most, that have numerous actions, but what I want you to know is that it helps us side bend or laterally flex at our lumbar spine. Okay, so in terms of understanding how these different muscles are stacked on top of one another, I'm just going to kind of talk you through it, and you'll be able to see this better on the models and in your textbook. But the most superficial muscles here are our trapezius and our latissimus dorsi, so that's why I was kind of drawing those first. Those are the most superficial ones that we can see. And then kind of if you were to take those back and look deeper after you peel those muscles back, you'd be able to see the erector spinae and quadratus lumborum that are more deeper muscles. Now, that's not necessarily something that it's just going to be kind of hard to see that on this figure, so I encourage you definitely to look through your book and look through the models so you can see that the trapezius and latissimus dorsi are a little more superficial, and then the erector spinae and quadratus lumborum are deeper. Okay, now again, these are split up into different parts, and there's a lot more detailed back muscles that you will likely need to know later if you get into a field that relies on lots of identification of muscles, but these are the main ones. Now, what I want you to do is follow me along for one more segment. We're just going to talk about a few chest muscles. And that'll be the end of this segment. So here's our chest. And we're going to draw an anterior view of someone, but it's going to look kind of comparable to that back muscle guy that we just drew. So again, I'm going to try to make him symmetrical. Doesn't always work out fantastically, but here's our anterior view. And I really just need you to know two main chest muscles. There's our sternum in the center and clavicles out towards the side. So the first muscle I want you to learn here is called our pectoralis major, and that's going to go from our clavicle to our arm, but it's also going to go from our sternum to our arm. So there's going to be basically two different parts of it, but I just need you to know it as one major muscle, and that's our pectoralis major. There are a lot of actions for that muscle, but I just want you to know that it adducts your shoulder or it brings it closer to midline. You could also say it adducts your arm. Either way is correct. But when we're talking about that action, remember that it attaches to our clavicle and sternum and to our arm. So it makes sense that when we bring these two parts closer together where the muscle attaches, like if we bring our arm closer to our sternum and clavicle by shortening the muscle fibers, it's going to adduct our arm or bring it closer to midline on either side. Now, the only other muscle I want you to know is our pectoralis minor muscle, and that's going to attach to like some of our ribs here and a little, it's actually going to attach to our coracoid process of the scapula, which is like a little part of the scapula that pokes out anteriorly here. So that's our pectoralis minor. Our pectoralis minor muscle is going to be deep to pectoralis major. And what I want you to know this pectoralis minor muscle, because remember how we talked about the anterior and middle scalenes as having the brachial plexus travel in between it. So it's important for a lot of different neurological conditions that people can present with in the upper extremity. Well, this pectoralis minor muscle is actually another place where those brachial plexus nerves can travel under. So it's another instance, just like the anterior and middle scalenes, where if this muscle is a little bit too tight, it can disturb the nerves and lead to different symptoms in the upper extremity. So that's why I want you to know these. So we've now covered our facial muscles, our muscles of mastication, or the muscles that help us chew. We reviewed our eye muscles, our neck muscles, and then lastly on this page we just covered our abdominal muscles, our back, and our chest muscles, and that wraps up the first section of the muscular system.